Hi beauties, welcome back to my channel. My name is Shweta Vijay and today we have a very different video. Not at all beauty related. It was time that I spoke about my infertility journey, my IVF journey, and I needed to be physically and mentally prepared to talk about it. Now, when I asked you guys, to ask your questions to the doctor that was in charge of my entire process, I got a lot of beauty related questions as well, and that is something that I'm not going to address right now. I will talk about it in the near future. There's going to be a lot more videos that is related to pregnancy and pregnancy care. This is Dr. PARASURAM Gopinath, who is the senior consultant as well as the medical director at CIMAR. Okay, he specializes in infertility, embryology, as well as advanced technique like oocyte cryopreservation, isn't it? In layman's words, it's basically egg freezing, okay? That's the very social media term for it. So, doctor, thank you so much for joining my viewers, okay, and welcome to my channel. Would you like to give a small little introduction so that, they would get to know you a little more?
Right, okay. Thank you, Shweta, for this opportunity. I think like we had discussed earlier, I think we definitely needed a platform where we could actually discuss all these issues. And to introduce myself, I am Dr. PARASURAM Gopinath. I am the Senior Consultant and Medical Director at CIMAR Fertility Center. I did my undergraduation in JJ Medical College, Davangere, and my post-graduation in SRMC, Chennai. Following that, I have joined my institute where my father is a senior consultant, and I've trained with him in major part of my career. And after that, I did go abroad, like places like Singapore, Germany, and all, wherein I did short courses. But I think what really helped me was basically studying a lot of things on the job. Yes. So I was very fortunate that I was working with my father, who was also a very renowned specialist, and I could actually imbibe in, or I could get in so much of information, so much of. See, what is fortunate about, I think, our generation, probably the second generation, is that we could learn a lot from the mistakes what others did or our seniors did. Yes, so we could actually kind of learn a lot of things. So, and they learned with so much of difficulty, and it so easily got transferred to us. Even though I'm a gynecologist, an obstetrician and gynecologist by my degree, my focus has always been fertility treatment, and I'm a very focused fertility specialist, and I do only this.
My main focus of making this video is that in case you're coming to India, because I've got a lot of NRI viewers, if you're thinking of coming to Kerala, you know exactly who to meet, where to go, how much an approximate cost would be, the entire detail, the whole 9 yards of an IVF, IUI treatment, as well as egg freezing that so many of you have asked me questions about. I know a lot of you wanted to be anonymous, and I'm going to keep all that secrecy. Keeping that in mind, I'm going to ask your questions and we are going to get into details so that this video would help you. Does PCOD during teenage cause infertility? Now that's a question that kept on repeatedly, it was asked to me. So does PCOD as well as the thickening of uterus lining, are those an issue that plays a very important part when it comes to being fertile or infertile in many ways?
I think probably this is definitely one of the most important questions that should be answered today, because you meet up any kid, or probably I get at least a couple of calls in a week from my friends who have their daughters in this particular age, and they tell me that they have this PCOD. What do we do? PCOD, unfortunately, is the most diagnosed entity as far as teenage people are concerned, because what happens, it is polycystic ovarian syndrome or disease is what we always address it as. So what basically happens is they'll have some menstrual irregularities, that they'll go to a gynecologist. The gynecologist will ask them to do a scan, and once they do a scan, they will say that yes, the ovaries are having multiple small follicles, so it is a PCOD. So every polycystic ovary need not be a polycystic ovarian disease or a syndrome.
Okay.
It just means there are good number of follicles in your ovary, or you have enough and good number of follicles. The challenge always comes when you have irregular cycles. Now, if you look at the diagnosis of PCOD, now how do we diagnose a patient with PCOD? They say it is polycystic looking ovary, irregular cycles, and hirsutism. Hirsutism means like excessive hair.
Okay.
Now, how much of hair is excessive is again a big question. Some people are so concerned with that pubertal time. that once they like that 13, 14 years to like 17, 18 years, this is when they start getting all the pubertal signs, and then they get so conscious. So I think a lot of times what happens is they are misdiagnosed with PCODs, and then they are kind of are treated for PCODs.
Okay.
So I think, see, PCOD, if there are certain patients who have PCOD, will remain PCODs over the years, and as their egg reserve comes down or as their age comes down, the PCOD goes away.
Okay.
You can never treat PCOD and remove it off.
Okay.
Probably we treat it for the symptom. See, when the patient is having irregular cycles with PCOD, and if irregular cycles are so much of a concern for that particular person, we treat irregular cycles. Once the patient gets into a time where they get married and they want to have a child, we treat them for that. So PCOD is a disease that you treat according to the need of the patient. Please don't, especially these young girls who have got irregular cycles, see, there's no hard and fast rule that every woman has to get ovulate every month. I'm not saying, yes, ideally yes, if you want to conceive, you ovulate at least once in a month, it is easy. But otherwise, they say that if you are able to menstruate at least 3 to 4 times in a year is fair enough, good enough. You don't need to.
Interesting.
You don't really need to take medicines and make sure that okay, I'm going to menstruate every month. See, it is not like it's not like a mandatory thing. Yes, definitely you cannot keep having a menses like say once or twice in a year, because that's a long term that you don't have menses.
Yeah,
and then when you menstruate, what happens? You end up having a lot of bleeding and difficulty and things like that. So 3 to 4 times or 4 to 5 times is a good number of time that they can menstruate while they are not married and they are not really looking at pregnancy. So the major treatment comes when there are these women with PCOD who have irregular, not just irregular bleeding, when they get bleeding, because they don't see what happens with PCOD is that they have so many eggs, and because of some hormonal imbalance inside them, there is no that every month there is a follicle that comes up, becomes big, and it ruptures and ovulates. This ovulation does not happen because of the hormonal imbalance. So there are so many small eggs. So for a very long time, only one particular hormone will come and act on the uterus, make it thick. And one fine day, what happens is it will not ovulate. Normally, what happens with the ovulation, there is another hormone that comes, and it will change the pattern of the uterus, and it will make it shed. So that is a normal way it happens. But in PCOD, the ovulation is not happening. So it becomes thick, and reaches a point of time where it is not able to hold on that much of thickness, and it bleeds. And at that point of time, these patients will have torrential bleeding, and then that is very disturbing for a lot of people. So otherwise, see, even if you get periods in 1 to 2 months, or it's fair enough, 2 months or maximum 3 months is, I would always say that don't be in a hurry to treat. And one of the first or the foremost treatment is the lifestyle change. If you look at any kind of PCOD patients, it's basically not necessary that you have to kind of do so much of workout, but then some kind of workout, some kind of activity is very important to sustain that or reduce that symptoms of PCOD, because PCOD people tend to get on weight faster, and once they get on weight, the symptoms become more severe. So it's a chain reaction. So always, if you are having a healthy lifestyle, probably you are able to overcome this for a lot of times, and you will need some form of treatment probably only at a time when you are actually going for a treatment or something like that. At that point of time, if your hirsutism or excessive skin growth is a concern, get treatment for that. Don't unnecessarily take in too much of hormones, especially young girls.
Sorry, that's part of another question. Do treatments for PCOD, like I know many doctors, many gynecologists put you across with birth control pills.
Correct.
Does that have a long-term effect where infertility is concerned? Does that play a havoc in the whole system?
Definitely not. Actually, the oral if you look at it, oral contraceptive pills are the most commonly used pill worldwide. If you take any kind of medicine that is used by the maximum number of women around the world, if you look at that, the most used pill in the world is actually oral contraceptive pill. Yes, a lot of people do talk about side effects of oral contraceptive pills and things like that, but then that is a very minuscule number of people who need it. But like I said, unless the symptoms are very severe, I really don't recommend giving oral contraceptive pills. But then if the patient needs a bleeding, and if they want to kind of time it, or there is a thing that they want to time it, at that point of time, having occasional oral contraceptive pills is not definitely going to affect the future pregnancy. Now, PCOD people are people who are going to have difficulty in ovulation. So that is why they have a more difficulty once they get married to when they're trying for pregnancy. See, normally what happens, every woman is ovulating one egg in a month. PCOD people are not ovulating one. They probably in 2 or 3 months they are ovulating once. So the chance of trying for a pregnancy is much lesser. They don't get enough number of time that they can try. Imagine one person trying 3 months, they get 3 attempts, whereas this PCOD patient, poor girl, is only able to try only once in 3 months. True. And they don't know when this is happening. See, that is the biggest issue, because this is one information that I always tell our patients, because even you're talking about teenage, now especially even people who get married and they start planning for a pregnancy, especially people with irregular cycles. I think everybody today are so tech savvy. They do talk about having these apps which tell them that, okay, this is the day that they're going to ovulate, and
the whole cycle,
and then they actually on the net they tell you that this is the number of times, that this is the days that tentatively you're going to ovulate. So they always say 14, 15, 16 days. But what happens, especially in women with irregular cycles or people with PCOD, is that their ovulation is much later. But what does these people do? They will try during 14th day, 15th day, and then after that they're worried that if they have intercourse, something might happen to the baby. So they will think that if they're pregnant, let's avoid. But what has really happened is they really had not had any sexual intercourse during the time of ovulation. So they miss it completely. And a lot of these apps always sometimes end up getting it wrong. Somebody who's having a regular cycle, things are different. Probably it works more perfectly. But people with irregular cycles, kindly don't look at dates, kindly don't look at apps. It can go wrong and it can actually give you the wrong information.
Sure.
That is, I think, a very important information, especially today's generation should know. That don't, especially women with irregular cycles, please don't follow apps and dates and things like that.
How can out-of-station patients take treatments at CIMAR? How long is the stay process in Cochin if they have to come here? And when one begins IVF, what are the pros and cons that they should seek after?
Okay, all three are very long answers.
Yeah.
The first part basically, yes, generally currently what facility that we have is, earlier in India we could not do a lot of these online consultation, but thanks to COVID we have online consultations which are made legal, so we can actually kind of have a discussion, plan your treatment. Now planning your treatment, probably we'll have to know their menstrual cycle, so decide on what are the menstrual, how the menstrual cycle. Depending on the menstrual cycle is how we will plan the treatment. Tentatively, a majority of the people will be able to do the treatment in 4 to 6 weeks.
Okay.
4 to 6 weeks. This is general. Now sometimes what happens, if you have planned the treatment from there itself, probably you take an injection from there and come on the 2nd or 3rd day of your cycle. We can even do treatment like that. So at that point of time you have to be here only for say a month. So when I say a month, like say we don't insist, or probably it isn't, first of all I think everybody should know this is an OPD based treatment. You don't really need an admission to do the treatment unless you're from really far away and you don't have facility to take injections nearby and things like that. You can always stay in the hospital or around the hospital, but otherwise we don't insist anybody to get admitted to the hospital or anything. So we generally start with one particular injection, say around the 3rd week of the previous cycle, then we call them back on the 2nd or 3rd day of the cycle, and then on that day we will start injections. On an average the patient has to take around 10 to 12 days of injections. We'll call them after 7 days. The first gap will be after 7 days. Then after that, depending on the scan and the blood tests, we will decide, we call them after 2 days or 3 days. And once the follicle is ready, we give them a trigger, and 36 hours after the trigger we take the egg out of the body. Now at that point of time we'll take the husband's sperm, and we have the egg and sperm with us. In the IVF lab we fuse them, make into a baby, grow it for 2 or 3 days. Now if things are okay, we actually transfer these embryos back into the uterus of the female. Once we transfer the embryos, again there will be another 15 days of supportive medications, because this is a completely controlled cycle. We are controlling everything in the body, so the body does not know that it's getting pregnant. So that is the reason that we are even having to give supportive medications. So we give them supportive medications, and it's actually 15 days after the transfer and the supportive medications is when we will know whether she's pregnant or not. Yeah. So that if you want to stay till then, probably it's like say on day 2, day 3 onwards, 15 days your treatment is done, another 15 days your process is done. So it's like actually your results are out. So it's 1 month will be the treatment if you look at it till the time that you know the results. And in some certain situations we call them 1 week or 10 days before we start the initial process,
Yes.
so that we prepare everything, so we know that what is going to happen, we evaluate and all those things. So generally we say 4 to 6 weeks is an ideal time for somebody to come and spend here, and definitely you don't need daily hospital admission. You can actually come and go.
Something like what I did. I actually
Yes.
stayed for a month and a half near to the hospital, only because the facility was near me,
Near me.
and where injections were concerned, I could get the proper timing to get myself injected, and I thought that was the ideal situation. So there was another question, like for example, if someone is coming for the treatment at CIMAR, do you suggest them to stay till their pregnancy, or they can travel back to US or UK, wherever they are coming from?
See,
is that something you would recommend?
See, we have a lot of patients who come from the UK, US and all, who just come here, finishes of the treatment and goes back. So I wouldn't say that there is a major issue by actually traveling back, because a lot of people do that.
Yes.
And you cannot really
Make them stay
make
here,
them
yeah.
stay and make sure that they don't travel. So it's practically not possible. So, but only challenge is, especially in difficult patients, where we might have to support them with additional injections.
Yes.
And see, those group of people, what happens with them is that, see, when they go abroad or when they go to US, see, them to get medical care is very difficult.
Yes.
So when they go, see, you need to, if there is a problem, if there is bleeding, you have to go to see the doctor, and then the doctor will give you an appointment to see a specialist. Now seeing the specialist will take another 2-3 weeks, because to get an appointment for the specialist. But in that way, Indian medical system is so easy. You can meet the super specialist any day. You can walk in and meet a super specialist.
Yes.
Unlike
how it is. Yes.
How it is in
I
the
understand,
UK.
because with the NHS it's the same thing
Same.
as well. It was difficult for me.
So technically we don't say, but then when it's a difficult case or something like that, we always say that, okay, let's see how the pregnancy is and then decide as to how we go. Because see, what is unfortunate is that now if things, honestly, if you're not able to give enough support, or you're not able to, and if it fails or it becomes an abortion or something like that happen, see, you have to go through this whole process again. And when you're going through this whole process again, you really don't know whether you're going to get again pregnant. See, that is the biggest challenge. See, it's just not about what you say, just you going through this process and it's like, oh, you get an abortion, okay, let's try again. You really don't know, the next time you might not get pregnant again.
I know.
So that is a big challenge. So that's why I said regular patients, I don't think there is any specific reason that they should stay back.
So it depends on the patient, how
Patient,
difficult the situation is, and their processes.
Correct.
Then you would suggest whether okay, they can
prefer
travel
to stay,
or perfect to stay.
Because probably when things are under control, probably I would say we sometimes little overtreat them also, for the same reason that you really don't want something to happen. You don't want something to happen and later on say that, okay, I could have done that also. Okay, I learned it now, let's do it the next time. See, what happens, to be very honest, what happens in the UK or the thing is that they have set protocols.
Yeah.
They cannot do a particular treatment unless it is proven that it is good. So they will wait for you to fail so that the next time they can correct it.
Yeah.
But the problem is, the next time we really don't know whether you're going to get pregnant again.
Yeah, true.
So India, fortunately, in that way, we are having the resources to make sure that we give you everything possible to make sure that it carries on. Yes, so sometimes this is probably one particular situation where some little over treatment is better than under treating.
Yeah, of course.
The difficult ones, I'm talking about the difficult ones, not the regular patients.
Yes, absolutely.
Whenever a patient comes to, this is something which I always tell in majority of my talks, like I think whenever a patient comes to you for a treatment, I think they should have 3 basic ideas of when they process. One, what is the process, or why are we doing an IVF, or is that the right treatment? Have they decided, and how they are deciding on the treatment, and what is the process? Like I was telling you, like you have to come on this day, then come on the second or third. So they should have a clear picture as to how the process is going to happen, so that they can also be prepared. Because it's just not about just coming one day. A lot of times what happens is you come on this day, the patient will go and come back the next day. Say, I come on third day. See, when the patient is not prepared, it might cause unnecessary confusions and things like that. So one, they should have a clear idea of how the process that we are going to do is going to happen. Second, very important is we should always talk to them regarding the cost, a tentative cost.
Absolutely.
We should always tell them, this is the tentative cost that is going to come for the procedure, this is the tentative cost that's come for the medicines, the blood test. So overall, this is what you should expect while you're doing this treatment and things like that. So a basic idea of the cost. Now little variation can happen. Certain people might need lesser medicines, might need, you only give them less, the cost obviously become lesser. But when you look at
extreme difficult
cases where you have to give them higher dose of medications, that time the cost might become.
Yes.
And the third and the most important aspect is to understand the results. Because when they are doing a treatment, they should have a very clear picture as to how much is the results that they should expect for doing the treatment. Now, because that is the most difficult and difficult part to convince the patient, because if you realize the best result in the best patient is not more than 40 to 50%. Now, as the problems increase, the results will keep coming down. See, a normal husband and wife, they try to get pregnant, the best result is around 20% normally. So when there is a problem, the results are much lesser. So when they try to do some treatment, and like say treatments like IUI and things like that, we are trying to reach that 15 to 20%, that's all. But with IVF, we are able to double that result. That 15 to 20%, we are able to get 40 to 50% with an IVF. Now that is the best group of patients. And with the problems like the age, the disease because of which we are doing an IVF for them, all those things, the results will start falling. So a patient, if what I believe is a patient goes to any good clinic, every clinic should be able to give them the same result.
Yes.
Because it's as simple, because ultimately the sperm, egg and the uterus and the patient. So if the same, because these are the byproducts are the most important aspect. And that's when I said specifically that it's in a good clinic, so I'm assuming that at least majority of the good centers will have a good lab, good facility, good medications, good protocols. So if they're able to see, because why I'm saying this, a lot of people will call us and say, what is your result of IVF? See, it is not the IVF center's results, it is the patient's results. Because a 25-year-old female who has slight husband sperm abnormalities, that is the only problem, her results will be very high. At the same time, a 25-year-old with endometriosis or having multiple surgeries in the ovaries, the results will be much lower. So the results are of that patient. It will be very different from the results of the patient before you, different from the patient after you. So you cannot say that, okay, that patient, the results were this, so my results. Because I end up seeing a lot of people like, they're so surprised when I tell them that, okay, you should expect say 20% results or 25%.
Disappointed.
Like, so they're so disappointed, but I think or I believe that they should have an idea as to how much they should expect.
Yes.
They should not over expect, they should not under expect. They should have a clear idea. So it will help them to face the failure if it happens.
Yeah.
And you know that when I say 40 to 50% success rate, that means 50 to 60% failure.
Yes.
So it is easier for them to face it. So these three are the most important things that a patient should understand before we go for an IVF treatment.
I think the mindset when they come for a treatment itself, they think it's going to be a success.
So, that's what we should be very clear. We should always tell them, because a lot of people are so. I have patients who have come, and when I told them that this is a result, they just walked away. They said, "What? I don't know." I've seen people who are 45 getting delivered. I said, "Yes, I'm not saying that you will not get pregnant, but what I'm trying to say is that the results are lesser. I'm just saying that results are lesser. See, look around you. How many of your 45 years or 42 years or 50 years you're seeing them pregnant compared to somebody who's like 32, 33? Yes. So definitely as your age increases, your success rate will decrease.
Yes.
And so whenever we are doing a treatment, or depending on the problem, we should always accept the result and then do the treatment.
The approximate cost, do you usually discuss this with your patients as well? Do you give them like a approximate estimation?
Yes, very, like I said, the second most important thing that we tell our patients is the cost.
Would you be able to tell my viewers?
Yes. See, generally what we do is like we charge around 95,000 rupees as a hospital charges, which includes all the things that happens in the hospital, the embryology, lab charges, all those things. Then in addition to that, approximately around, depending on the patient, the medicines and blood tests, everything will become extra. So it can vary from say 60,000-70,000 rupees to 1 lakh, depending on the severity of the case. So I'd always look at when a patient goes for an IVF, they should expect somewhere between 1.5 to 2 lakhs as the approximate cost of the treatment that they're doing. Now, again, this is again a question that a lot of people ask, like, you said this, like, it took us 4 lakhs to do the treatment. It took us, see, now if you calculate the auto that they came in every visit and went back, if they calculate they had to come and stay in a hotel and you add those charges, lot of times you ended up having to do another procedure in between. For example, there will be we might have to do hysteroscopy or some procedures while during the process.
Yeah.
All these things are additional costs.
Yes.
But if you look at IVF per se, when you're doing it, it is somewhere between 1.5 to 2 lakhs. A normal patient without too much of a problems will be able to do a treatment and say 1.5 lakhs. But then at the same time, a little older patient whom we might require a little higher dose of medications and things like that might
could go a little more than that.
Yeah.
So I would say more than 2 is what
around 2. And say if you do an additional procedures, like say if you're doing a hysteroscopy, if you're doing if you have to do a laparoscopy in between, if you have to do advanced procedures like IMSI or like IMSI is like selecting the sperm under a very high magnification, especially in repeated IVF failures patients. If you want to do sperm selection technique, some kind of different kind of sperm selection technique, if you want to do all these additional things, probably there can be a basic additional charge that goes in, but basically it generally is somewhere between 1.5 to 2 lakhs.
What is the difference between IUI and IVF? Should one go for IUI first and then IVF? I have PCOS and my gynac suggested IUI. What makes it too late to even try IUI and go straight for IVF? Okay,
now when you look at, I'll just tell you about the treatments of infertility.
Sure.
See, the treatment of infertility, if you look at it, that 80% of the people who come to a general infertility clinic conceive just by counseling. Okay. Because a lot of people have this misconception. Just like I was telling you, they don't know the real time of ovulation. They don't know when they have to try. They don't know a lot of times. I would say 80% of the time it is purely by counseling. In that 20% of the people will require some form of treatment. Like say ovulation, like produce more number of eggs. That's called ovulation induction. You produce more number of eggs. You like say one egg is coming, she is not getting pregnant, so give them more eggs, so at least one of them will become fertilized by the sperm that enters.
Yes.
Now in certain situations, like somebody having sexual problem or somebody having a little deficiency in sperm, not very poor sperm, IUI will not help. There's a procedure called as IUI. IUI is nothing but pushing the sperm, washing and preparing the sperm and concentrating the good part of the sperm. See, you're not making the sperm better. You're only taking the best part of that particular patient's sperm, concentrating it, putting it inside the uterus at the time when the ovulation is happening.
Okay.
So we give her medicines, produce eggs, we give injections for the eggs to rupture. We confirm the rupture, and at that point of time, you take the sperm, wash it, and put it inside the uterus. It's like a shortcut.
Okay.
Normally, what happens is you ejaculate into the vagina. The sperm has to swim through the cervix into the uterus. It goes into the tube. Outside the egg is ovulating. It goes into the tube. So both of them will end up meeting inside the tube. It becomes an embryo.
Yes.
Slowly comes and falls into the uterus. So actually, it's a very technically, wondering thing that happens actually inside. So it's so easy not to get pregnant. Unlike, so when I said 20% chance of getting pregnancy, because I think a lot of people have this perception of movies and all, you have sex once and you get.
That's it.
That's it, and you get pregnant.
Have two flowers also hit each other and you're pregnant. Yeah.
So for them, they don't realize that getting pregnant is not that easy. Some people find it so easy. Every time they're so fertile that they try and they get pregnant faster.
Yes.
But in majority of them, they don't get pregnant that easily. So IUI means you are taking it one step ahead. That is, you are producing more number of eggs and putting the sperm. So it's like kind of a shortcut of things what is happening. But for an IUI to be working, you should have everything else normally. Especially the female inside has to be normal.
Okay.
The tubes have to be normal because the sperm, the tubes have to, anyway, egg has to come through the tubes into the uterus, and we are only kind of overcoming that sperm being pushed into the uterus. That is the only thing that we are doing it. So IUI is a very simple procedure. It's actually like sexual intercourse only, but we are just timing things and making things happening, and we just washing the sperm.
Science into it.
Bringing science into it. It's basically only that.
Yeah.
But if you look at IVF as a more technical thing, see what basically happens is everything that is, so like I said, there are so many places where things can go wrong. Like if the uterus it's not going into the uterus correctly, it is going somewhere else. If the egg is coming here and the sperm is going there, all those things can be reasons why patients are infertile. So IVF means what happens is you have an egg, you create an egg for the female, you take it out of the body, you have sperm and fuse it outside. So test tube treatment or IVF, in vitro fertilization is, in vivo fertilization is fertilization inside the body, in vitro fertilization is fertilization outside the body. So you're fertilizing it outside the body. That is, IVF basic process means you have the sperm and egg, we put it into a small dish and we wait for that to become an embryo. That is a basic IVF. And the next procedure that is called as an ICSI, that is intracytoplasmic sperm injection. That is, you take a sperm, now especially in patients who have very less sperm or thick egg, some oocyte problem or sperm problems when the sperms are very less, what we do is we take that sperm, inject that sperm into the egg and make it to an embryo. So the possibility of becoming pregnant, that egg becoming an embryo is much higher with an ICSI. But then everybody don't need an ICSI. A lot of times IVF is good enough, but if there are some issues, then we'll have to do an ICSI process for them. So, but then here we don't really say that we are going to do an IVF or ICSI for you. Whatever may the patient require, we just do it for them. If it's an ICSI, we do. See, majority of the time we end up doing an ICSI because we don't want them to fail. Yeah. See, if it does not become an embryo, I cannot see, for example, in the UK, I think it's mandatory that you don't do an ICSI first. You do an IVF.
Yes.
It fails, then you do an ICSI. Come back. See, again, next time you have to go through this whole process again. And probably they are able to dictate it because it is funded by the NHS. So they pay for it, so they decide what is to be done.
Yes.
Whereas here, a patient comes to us, they want to get pregnant in the first attempt. They don't want to go through several failures and then go through that.
The maximum success.
They want to get the maximum. So at that point of time, most of us actually end up doing ICSI for majority of the patients. But IVF is the basic treatment, then the next step is ICSI.
So with IUI, is it the same medication given then with an IVF patient?
No,
is it the
IUI
same?
is much simpler. Like I said, we don't want too many eggs. We just want, in patients like say PCOD or somebody who don't produce eggs, we just need one egg is also fine. So we just give medicine, so you produce 1 or 2 eggs. But who are already having 1 egg, we'll give the medicines to make some 2 eggs or 3 eggs, so that we don't want too many eggs. Because again, one of the complications of these things are having multiple pregnancies. Now, multiple pregnancies, okay, it's not a very big thing in India, but if you go abroad, in the UK or where they're so concerned, they talk about cancelling an IUI cycle if the patient makes more than 3 eggs. They say that if multiple pregnancy comes, the burden is actually on the government. The burden of the child, because if they have multiple pregnancy, the chance of preterm labor is higher. They deliver that baby faster. If they deliver that baby faster, then the baby goes in an ICU, and that charge or what the government spends on the patient will not be able to afford the patient in the ICU. So NICU is not able to go through that NICU setup, and then baby complications. If the patient goes in an ICU, baby can have a lot of additional problems. So we always prevent or try to avoid multiple pregnancy. But like say twins and all, here in India we manage. It's not a very big deal because here people want that maximum benefit out of the money. They get it one IVF, they have 2 kids, they're done. So double bonanza. It is like one free with other. That kind of.
The whole family is done.
Family is done. So they're happy. Then they don't want to. They're done with it. Otherwise, like again, they have to go through this treatment. Again, they have to go through this whole process.
I know.
But yes, it is not something that we intentionally want them to have twins or intentionally that we want them to have multiple pregnancy. But yes, when multiple pregnancy, we take them forward like that and get them delivered. So with IUI, we are looking at 1 or 2 eggs. So we only give them very little medications. We will not give medications as what we had given in IVF. Whereas in IVF, we will end up giving majorly injections only.
Yes.
Unfortunately, we don't have any tablets or oral medications that can replace these injectables. Because we are looking at say making 10, 15 eggs. Whereas in IUI, we are looking at making it 1 egg, 2 egg, 3 eggs like that. And when I'm giving this, see, when I say I want 10 to 15 eggs in an IVF, it's not that I'm going to take 10, 15 eggs and 10, 15 babies are going to get formed. If the patient makes around 10, 15 eggs, there will be, when I take the egg out, there will be approximately around 10, 12 good quality eggs might come out of that follicles. So we're talking about number of follicles. When you stimulate, we don't see the egg, you only see the follicles in the ovary. So we take that, we aspirate the follicles, we might get around 10 to 12 eggs. We do an ICSI or an IVF, we try to fertilize them. Not necessarily all 10, 12 of them will fertilize. There's a say 70 to 80% fertilization rate. So that means around say 8 to 10 or 7 to 8 is the number of embryos that get formed. And then again we grow them for 2-3 days. So again from there only some 5 to 6 embryos. Ultimately when we aim for 15 eggs, we are actually going to have say 4 or 5 eggs or 6 eggs, embryos that are of top quality, which can be used. And when we have these many number of embryos, we transfer like 1 or 2 embryos depending on the situation. If it's a bad case, we end up transferring 3. So that is how we aim for. That is why we need higher dose of medications, and the protocol is completely different in IVF compared to an IUI. And the whole basis is that for IVF, we don't want the egg to rupture inside. We are taking it out of the body before it ruptures inside. Whereas IUI, it is rupturing inside. It's a very simple thing. We're just putting the sperm. That's all. For IUI, we're not doing anything else. But for IVF, we're actually making sure that we are making all the eggs, ripening it before it ruptures. We take it out of the body. So that's why it's a very controlled process, and that's why it needs so much of intense monitoring, in medications and things like that.
The cost of an IUI, is that way less than?
It's way less.
Okay.
I would say medications and scans and altogether probably it will charge you somewhere between 15 to 20,000 rupees.
Oh, is that it?
And
Okay.
IVF is like what it is 2 lakhs.
Yeah.
Now to the question as to you would ask whether somebody with PCOD should go for IUI or IVF. See, I think it depends again on their age, how is the semen factor, how the sperm factor. If it is a simpler cases, definitely we should always attempt and simpler techniques. See, a lot of people come thinking that IVF is a 100% result treatment. So they come thinking that you do an IVF, finish it off, have a baby and go. But I always tell them, please don't rush into it. Always we need to go in a step-by-step manner. If there are no specific reasons that you don't warrant direct IVF, always go in a step-by-step manner. Try medications, try IUI. If that does not work, then check for tubal test, laparoscopy, again IUI, and things slowly we go into an IVF. Because if you're getting pregnant faster through a smaller technique, sometimes like I said, no, just by counseling or just by talking to them they get pregnant. Because
the right way of going about it.
A lot of people whom we think are educated probably have no clue of what actually happens.
Yes.
So it's very important that we talk to them. You ask them, yeah, we are having regular sex. When you ask specifically, they'll say, yeah, on those 2-3 days we are having regular sex, and after that no sex.
Yeah.
And sex has become so difficult now at this point of time. Lifestyle is difficult.
Yes.
It is unlike that what was earlier. Now this is a big stress factor. So stress factor, infertility, sexual life, it's all become a cycle. One affects the other. Infertility affects the sexual life affects infertility, stress. All those things have now
they play
a role. So if there are no major issues, definitely we should try an IUI, try for simple treatments before we go for an IVF. But if the female age is higher, if age is higher means like 35, 36 plus, if we do the semen factor is bad, if she has associated issues like endometriosis and other problems, multiple other problems. If you have multiple problems, then probably at that point of time,
you don't suggest
we don't say that don't waste time with
IUI.
Smaller treatment, because ultimately we might have to
go for IVF.
Go for an IVF. Because there is a very good analogy that we always tell our patients, like see 2 plus 2 is equal to 4. Okay. Similarly, 3 plus 1 is also 4. So what I'm trying to say here is that not necessarily both have to be perfect.
Yes.
Sometimes you see a lot of PCOD patients who get pregnant normally. Because the sexual life is so good there, because they are having a very regular sexual life. So whenever they ovulate, the sperm is there. Similarly, probably the sperm factor is very good, the sperm is very good. Sometimes you end up seeing patients with very poor sperm, but wife is easily pregnant because the wife is so fertile, it just needs some sperms to come in. So sometimes that partner makes up for the. So there's a funny thing is that, what do you say? A person can be fertile to one female and infertile to other.
Yes.
So not necessary that it is both are having major issues. Sometimes one can have a very major issue that can cause linked, or both can have small issues, just that it's not getting matching each other.
Sure.
So if you have a problem, does not necessarily mean that you will not get. Another very important thing, if you have a problem, don't think that you will need only treatment. A lot of cases who will with the problem also will conceive. So giving time to try for a pregnancy is very important.
What is the time that you usually?
Okay, now that is a very important thing. See, if you look at it now, tentatively what we always say is that we actually normally they say that in 1 year, like I said, the chance of or the possibility of you to get pregnant in the month is in a month when they're trying regularly.
Yes.
It's just not about 1 time sex or 2 times. They regularly have sex in that particular month. In a regular ovulating female, the chance of getting pregnant is around 20 They try for a whole year, the chance of a normal person to get pregnant is only 80%. Still, only 80% of them will get pregnant in the first month. So generally what we say is that if you're trying regularly for like say a year and you're not getting pregnant, yes, then it is time that you start evaluating yourself. Now things will be different if the situation is different. Like I said, if female age is about 36, 37, then we probably want you to come a little earlier, like say 6 months you try and then come back and then we can evaluate you. At least we'll make sure that there's no other problem, that we don't waste time on trying knowingly. If they know that they had a surgery, any kind of abdominal surgery can lead to infertility later on.
Surgery like
any any cyst in the ovary, or they had some kind of bowel surgeries or some kind of, because any surgery inside the tummy can cause adhesions. Adhesion means things will be stuck to each other. So see, everything has to be freely mobile for the normal things to happen. And if that does not happen, then infertility becomes an issue. So in these situations, probably you will have to come for treatment a little earlier, older patients, if you realize that you're not sure about the sexual life. Because see, if you look at one of the biggest reasons that today we have or increasing rise in infertility is because, see, today I'm not saying it in a very wrong way, but women, they basically, the age of marriage is delayed. So once they get married, say 27, say like they generally get married around 24, 25 years, and then they settled in there. Then once they get married, at that point of time, husband and wife don't want to have a child. Their sexual frequency is very good, but at that point of time, they don't want to have a child. So they will leave another 3-4 years. Then they're stable, they have a house, and then they decide, okay, now it is time. So see, the biggest challenge today is that people plan too much, and they decide, okay, this month I will try for pregnancy, the next month I am pregnant, and 9 months I'll go.
You're so right.
So and 1 month goes mistake, or first month fails, you're shattered.
I know. I know. It hits home very much. I completely understand what you're saying.
So what happens is that they don't understand, they get into the panic mode. To be very honest, they've only tried for 1 month, and 1 month trying and not getting pregnant is not a big deal.
And that stress also adds to it. Yes.
But then they are suddenly their whole world goes upside down because things have not worked as planned. So that is one major issue at this point. Today, a lot of people are not able to try properly because of these. And at that point of time, after 3 or 4 years, when they're trying, then the sex will be only as per the ovulation time.
Like performance anxiety.
Then performance anxiety will come. See, a lot of people are talking about people getting pregnant during these COVID lockdown times. See, because there is no stress, there's nothing else to do in the house.
I know.
They're sitting at home. There is no work pressure. There is no this thing. They're spending time with each other. See, a lot of times we are having to do treatment for a lot of these people because they're not able to try. To be very honest,
it becomes a job.
It becomes a job. So when they were having regular sexual life, they did not want to have a child, and when they are wanting to have a child, they are not having regular sexual life. So, and at that point of time, things they get worked up, they get stressed. So the things become, so that's why you end up seeing a lot of times today who have a child, you'll have so many years of treatment. Today I met a doctor, I was just discussing with him. He said that he had first IVF with a triplet, was twins or something, and then after a couple of years he got pregnant on their own. That stress factor is gone. See, that stress, that pressure of conceiving is, once it's gone, a lot of people who adopt a child get pregnant.
I've also heard so many cases after an IVF they have naturally.
So that is one information that people should know, that IVF does not mean that that is the only resort for them to get pregnant. Probably we are doing multiple treatments, but that does not mean that they waste time and they lose the time for IVF. They should go in a step-by-step manner, reach and do an IVF. Like if things are not working out otherwise, before they get very old, before things get worse, do an IVF, get pregnant. If not, but a lot of people say, oh no, I stopped treatment, and then 37 years, when they lose hope, a lot of people, they lose hope. A lot of people are there who lose, especially this unexplained infertility, where we don't really know a reason for. You see, then once they lose hope and they forget about having a child, suddenly they become pregnant. So many people we know. A lot of people who have an IVF failure after a couple of months they become pregnant, or they lose every hope and they leave everything and go.
Does it have anything to do with the fact that medicine has kind of like, you know, there's this rumor I heard, okay, it was like, oh, they have cleaned your system out. Now that you've done an IVF, you know, they've like completely, you're cleaned out. So there's a possibility of you getting pregnant again. Someone actually, educator, told me this.
No.
So I just want to know if that is something, there's a truth
I wouldn't
to
say it is completely true, but in a part way it is true. But especially what happens is, see, all that preparations, medications and all during the IVF, no, we are kind of suppressing your ovary, controlling and taking control of your hormones and things like that. Those things generally, so whenever an IVF fails, and when we say that we need to repeat IVF, we always give them 2-3 months. One, basically for the reason that we want the ovary to get enough rest before we start the next cycle. Second is, we end up seeing a lot of people getting pregnant during this time. Because
naturally,
because one, that the ovulation gets a little better, you end up having that one egg that is good, and see, you end up seeing the worst of cases getting pregnant naturally. We end up seeing the most simplest case of IVF not getting pregnant at all after multiple attempts.
Yes.
So it is a very difficult field in the sense that things are not in our control. It's unpredictable. So a patient, unless they don't have a sperm or they don't have an egg, I can never tell them that you will never get pregnant. But your possibility of getting pregnant is lesser. So let's go for a treatment. That's all we can say.
Okay.
If you waste time, you will even reduce the possibility of what is happening now also.
Now, I just wanted to ask you, you told me that you were mentioning a person who is young, who has got absolutely no problem, but was not able to conceive naturally, you would suggest an IUI, isn't it? But there's been many cases, I know friends, who even then an IUI has failed them. So how many attempts of an IUI do they have to go through before you decide, okay, the next step is IVF?
When doing an IUI also, I think the best result that we should expect is around 15 to 20%. Now, they say that technically if you are supposed to succeed in an IUI, they say 80% of them will succeed within 3 cycles. Around 90-95% of them will succeed within the 4th cycle. So it's not that you will not conceive after that, then just that the possibility of you to conceive after the 4th IUI is much lesser. So don't keep doing IUIs consistently. There are a lot of these people who keep continuing doing 10 IUIs, 12 IUIs, which is the wrong thing, because what basically happens is the more IUI you do, it's just not about, okay, yes, there was an era wherein we did not have an IVF, where we were very new to it, and like I said, when I had actually joined practice with my father, at that point of time, I had come from medical college, where we used to see people who are not affordable to do an IVF for something. We look, if we do 5 IUIs, 10 IUIs. I've seen that happen, but I was surprised that when I came here, I could see my father telling these patients like, no, you go directly for an IVF. But then it took me some time to understand why he's saying that. Because there are certain situations wherein there's no point wasting time in IUI, and like I said, the age issues, and when the 7 factors are very poor and all, there's no role for an IUI. But if things are okay, then definitely there is a role, but then does not mean that you keep doing it invariably number of times. You can couple of, I think 3 to 4 IUIs is a reasonably good number of IUIs, and if that does not work, it is time that you go for an IVF. If you look at it, I think the age is probably the most important predictor for your pregnancy.
If she is around 45, what would really help is if she did an egg freezing at a young age, she could have that quality egg easily put into her.
Whereas men, even if you have very less sperms also, your results are not that bad. So that is the whole idea of social freezing, that you are able to freeze the egg at a time where you have good quality eggs.
Is the process, once they have frozen their eggs and they're coming back, you know, to get that whole pregnancy routine, the whole journey, starting with the whole journey, is the process same as IVF? It says, is genetic testing done before IUI and IVF? There's a lot of myths regarding IVF. It's a lazy way out. Mothers are usually shamed, and why is that? Does having an abortion, miscarriage have an effect? Okay, so I've had an abortion when I was 35. I've had 2. Does that play a significant role in infertility? Is normal delivery never an option for an IUI or an IVF mother? And I heard babies born through IVF are never healthy. Now, these are things I've heard throughout. Could you just bust these myths?
I'll tell you.